This program is rated PG. It contains themes and scenes which may not be suitable for very young audiences. Parental guidance is advised.
Be advised that the views and opinions of the hosts and guests do not reflect those of the station.
There's a tear in your eyes, I know I can.
Good morning, Philippines. This is Dr. Cenica for What's Up, Doc? And today we have a very interesting topic regarding all about menopause. And before anything, I would like to introduce to you my co-host, no other than the beautiful attorney Cynthia Bajamunde. Sorry,
Welcome
attorney.
back, Jan.
Yes, because I've
welcome
been away for like almost 3
For the
weeks,
program.
and you know, I attended some postgraduate course and conventions, and we talk about stem cells in the U.S. And now we're back, and we'll be talking about menopause.
Yes.
Yes, and of course, you know, this our guest is an obstetrician gynecologist from Medical Center Manila, and most of all, she is I could say.
Our sis.
Sis in the fraternity Sigma Beta, no other than Dr. Natividad Generalao. Good morning, Doctora.
Hi, good morning, Jan. Good morning, sis.
Yes, and we will be throwing you a lot of questions regarding menopausal stage of women, you know. And we know that this is an everyday thing to you in your practice about menopause, asking questions, thousands of questions. But before anything else, for our televiewers who wants to ask questions regarding our topic, it's time to talk about menopause. And our cell phone number is 0925-852-0815. It's focused right there in your screen. Please indicate your name and your location where you are right now, and we'll try our very best to answer all your text questions. No calls, just text. Okay? Tony, sa tingin mo. How was WhatsApp, Doc? Akala ko kasi ano na to mapapalitan na.
Oo, magiging WhatsApp attorney na kasi he's been absent for three
Yes.
episodes.
Yes, could I call you Doctora Ko? Okay. When you say menopause, ano pa meaning nitong menopause?
What is menopause?
Oo.
Okay, yung menopause natin, ito yung stage ng babae, no?
Yeah.
Na tumitigil na yung regla. No?
Tumitigil ang regla.
Cessation of menstruation because of the aging of the ovary.
When you say aging, ano bang age bracket ito?
Yung average age of women who can na expected mo na darating na yung menopause stage.
Usually, it's from, it starts on the 45 years old.
45 years
Oo,
old.
hanggang 55. Pero the average is 51 to 52 years old.
Are there any like younger people who nagme-menopause?
Premature menopausal,
Yeah,
is there such thing?
meron kami tinatawag na premature ovarian syndrome, no? Yung ovary at an early stage, 20 pa lang sila.
Oh, may mga
meron,
ganun.
pero very rare lang naman. Pero I had one patient na 23 pa lang, hindi na siya nagre-regla. So premature ovarian, maraming cause yun eh.
What are the causes of this premature
Ano ba yung mga
menopause?
causes and symptoms pala muna?
O ang mga simptomas ng mga
menopause.
menopause.
Ang ordinary menopause.
Yeah, okay. Ang number one talaga dyan is, number one problema is irregular period.
Irregular.
Oo,
So once you
irregular.
started, nagkakaroon ko ng irregularity in your menstruation, kailangan mag-consult na agad sa obstetrician.
Yes, oo, kasi usually yan, nag-start na ng mga 45, nag-skip na yung regla niya. Pero hindi
Okay.
naman lahat ng nag-skip ng regla is
Nagme-menopause.
menopausal, di ba?
Menopause, okay.
So we have to also diagnose,
So yung
no?
premenopausal stage, may mga symptoms na rin ikaw
Yeah,
mararamdaman.
ang tawag namin doon perimenopausal. So ang
Perimenopausal.
perimenopausal, it starts on the age mga 35 to 40.
So ano,
45.
ito ba yung mga tinatawag na hot flashes?
Yes. Ang hot flashes is the second most common symptoms na kinukomplain ng mga menopause.
Okay.
So, yung mga hot flashes, itong hot flashes na to usually at night, no? It is caused by sudden o irregular level ng hormones sa katawan ng babae, no?
Okay.
Usually yan, sa gabi lang yan. Tsaka usually, mga 3 to 5 minutes lang yan every night. And then sometimes, because of the hot flashes, may association na hindi na makatulog yung babae. So, kaya nagkakaroon ng insomnia.
Kahit naka-aircon yung bedroom mo?
Yes, mainit. Pero ano
Mainit
lang
ang
yun,
pakiramdam.
ano lang yun, surge lang yun, balang mabilis lang yun, in 5 minutes, and then after that, mawawala naman ang
Nag-pepper-spray sila?
Yeah, talaga nagpapawis kahit na naka-aircon. And then, it lasts for how many months yun? Until
so,
talaga na...
Yun nga, let's say when you say you are in the menopausal stage and you're feeling these hot flashes, what you have said, how long does these symptoms last? It will take by maybe for life ba yan? Or
Usually,
months?
Usually, ang perimenopausal, it's usually mga 2 to 3 years lang yan eh.
2 to 3 years?
Kapag 5 years na yung ganun mong hot flashes, hindi na normal
Sabi
yun.
nila,
Very, very
daw,
rare.
parang mainit palagi ang ulo, parang may mga psychological problem ang pasyente pag nagme-menopause na.
Yung,
Psychological imbalance.
Oo, minsan
Yeah.
sa Amerika, nagpapa-psychiatric advice pa sila eh.
yeah.
Oo.
Kasi ang kasama kasi ng perimenopausal o menopausal symptoms, yung nagkakaroon ng mood swing.
Yeah.
Mood
No?
swing.
Mood
yun.
swing. Kasi yung estrogen kasi may epekto yan sa neurons natin, sa brain natin.
Ayun.
So kapag yung mababa masyado, no? Nade-depress yung babae because of the changes. Yung
Hormonal.
tawag na roller
Na
coaster
hormonal yung ano.
hormonal level.
Pero yung, for example, you told us na 2 to 3 years yung perimenopausal. So, for 2 to 3 years, medyo moody ka?
Moody ka. Pero after 3 years yan, makaka-adapt na yung anong katawan mo eh.
Okay.
So, after 3 years, mawawala na yan.
Okay.
Pero meron talaga, very, very seldom may mga umaabot na mga, isa nga, 60, 65 na eh. Meron pa rin symptoms.
But during the perimenopausal stage, kasama na yung hot flashes?
Yes, oo.
Yeah.
So, all the
Complain
symptoms
yan.
na.
Yan, yun na nga, yung irregular period, hot flashes, mood swing, no? Tapos
mood swing.
insomnia,
Okay.
depression. Usually, yan, very, very common yan.
Why depression?
Yung depression kasi, yun nga, dahil may effect nga estrogen sa brain natin, sa neurotransmitter natin, yung mga neurons natin, no? So, may epekto yon yung the transmission of mga signals, mga ano, no? So, pag magkakaroon ng depression.
Right. Now, this menopause women or on the menopausal or perimenopausal stage, is there still ba pwede pang mabuntis? Or do you have to give some birth controls regarding patient? Kasi baka mamaya sabihin, menopause na ako, di na ako mabubuntis. Biglang nabuntis.
During the
Yes.
ang
Perimenopausal or menopausal?
Yeah. Meron tinatawag ng menopausal baby, di ba?
Menopausal baby.
Meron kasi babae na mababa ang level, biglang tumaas, biglang
Yun.
nag-ovulate. Kasi ang responsible sa secretion ng estrogen is the ovulation.
Is it advisable to take some birth control pills?
Usually, pag yung...
Kasi siyempre pag during the perimenopausal or menopausal, very erratic ang
Yes.
level of estrogen mo yan
Yes.
Oo. Now, when you say erratic, maybe high, maybe low.
Yes.
So, is it advisable to
Actually,
take
that is one of our treatment. Kapag may mga perimenopausal symptoms, we really give
hormonal pills?
o contraceptives.
So, ang chances of getting pregnant is during the perimenopausal.
Kung mag-ovulate siya at natamaan na
Kasi nagme-mens pa sila, di ba?
At meron siyang contact, siyempre, you need a sperm and egg to have a baby. Kung wala siyang contact, kahit na nag-ovulate siya, pero pag very sexually active siya, so talaga may chance, no? But very low naman ang incidence. So, one of the treatment na we give talaga, pag nasa perimenopause, tapos kakaroon ng hot flash, we really give contraceptive. So, we 2 birds in 1 shot.
But for protection to
Protection at the
to
same
have pregnancy.
time. A source of estrogen and the progesterone para matackle niya yung symptoms niya.
Pero bakit yung binibigyan ng mga anti-birth control? Ayaw na niyang mga anak o may risk in giving birth?
No, it's more of the giving the estrogen.
No, parang 2 birds in 1 shot
Yeah,
na
2 birds in
Either number 1
Yeah.
for birth control, number 2,
It's secondary lang yung birth control.
number 2 is to level the hormonal.
The level,
But if you take that birth control pill during your perimenopausal, hindi ka talaga mabubuntis.
Definitely hindi na. Kasi basta tama ang pag-inom mo.
What about the effect? Kasi minsan nagkakaroon ng parang painful
Population.
Sexual
sex
contact.
no? Minsan kasi they have said that when during perimenopausal o menopausal stage, nagkakaroon ng dryness of the vaginal wall. And sometimes, pag nagkaroon ng dryness, nagkakaroon ng infection. Number 2 is that painful contact. So, may mga treatment ba sa ganitong problem?
Usually, meron tayong preparation sa market na yung topical estrogen.
Topical?
No? Yeah.
Oo.
Pero that is only for immediate relief. No? Kasi yung ang kaya sila nag-atrophy na kasi, nag-thin out na yung vaginal lining. So nag-thin out, so pag nagko-contact masakit. At the same time, manipis, very prone sa infection.
Ayun.
When you say topical, edi pinapahid.
Parang ano yun? Gel lang yun? Is that a
No,
gel
it's
or
in a
cream?
tube, tapos meron siyang applicator na para siyang ballpen, no? Para din siyang syringe. And then we put a certain amount of, meron lang level kung saan mo ipipindutin mo yung tube, and then you insert in the vagina.
So, doktora maglalagay nun?
Hindi, yung patient
Patient
or the
siya.
husband.
Or the husband.
Pero
So,
that
prior to the sexual act?
Yes, pero that is only for temporary relief. Kasi kung talagang yun ang problem niya, usually mas maganda na magbigay ka na ng oral.
Oh.
And
So,
then
combination of oral and
Yeah,
topical.
abang hindi pa nagte-take effect. Kasi it will take a while din naman eh.
Yung pill?
At saka yung nagpahid ka.
Okay.
It will take
When you
a
say a
while.
while, mga ilang oras o ilang minuto?
No naman. It's days, gano'n. Depende din sa
Days?
response mo yon. So, mas maganda talaga. Binibigyan na namin ng oral. Pero bago yon, sinasabayan namin ng
And you need
estrogen.
to put that every night or every...
Yeah. Ano yun? Every night. May dosage yun. Usually, 2 times a day. Umaga, gabi.
Is that available over the counter?
No, it cannot. No, because the hormones are regulated.
Okay.
So you really need prescription.
What about, because, meron tinatawag tayong treatment na HRT, yung hormonal replacement therapy. Is this a treatment for patients who are suffering from menopausal stage or perimenopausal stage?
Yeah, yung hormonal replacement therapy, ito na yun. We also use the contraceptive.
Contraceptives.
Marami kasing klaseng contraceptive, pero usually is the low dose estrogen. So binibigay namin yun to balance din, to replenish also the kakulangan niya ng estrogen.
So, all women na during perimenopausal yan o menopausal na po?
Mas maganda kasi, it is advisable to start it earlier. Kasi pag menopause na, lalo na pag the age of 60, it's not already advisable. Kasi dapat talaga, wala na talaga yon, wala na talagang estrogen. So, okay na yon, wala ka na talaga dapat symptoms. Pero pag meron ka pang symptoms, we really give. Pero kasi, yun, ako kasi ay na-advise ko sa patient ko, no, na menopause, it's a stage of life yan eh. So if you accept it earlier,
You have to accept it
Yes,
na it's
you cannot
happening.
stop it.
you cannot stop it and you accept it, mas madali kang mag-adjust yung katawan mo.
Oh, kasi minsan nasa denial stage
Yeah,
sila. Wala, ano lang to siguro,
Yeah.
parang na-stress lang ako, kaya nagkakaroon ako ng hot flashes or delayed in menstruation. Kasi, which is, baka mamaya sabihin ko, baka pregnant pa ako.
Yes.
Dahil sa nagkaroon ng delayed on menstruation, di ba?
Yeah.
Sabi mo nga, denial stage. And ngayon, how can we take care of this? If you're on menopause, ano ba, kailangan ko ba pumunta agad ako sa OB or family medicine? Ano ba, may treatment ba sa menopause?
Yes, ang maganda kasi diyan kasi talagang very inconvenient for you na
Yes.
na hindi ka nakakatulog. Kasi pag hindi mo na-tackle yung depression mo, eventually magkakaroon ka ng problema psychologically, di ba?
Psychologically,
So you
yes,
really have to
exactly.
treat that.
Oo.
At saka minsan talagang lalo na pag masyadong depressed at hindi nila na it also sometimes they suicide or yung quality of life is affected, di ba? So once you experience the symptoms, mas maganda magpunta ka na sa gynecologist.
Pero yung sinasabi niyo pong medicine, lahat po ba ng women na reaching that stage of menopausal na should take that?
No, it depends nga kasi merong mga nagme-menopause because alam nilang menopause na sila, they were able to adjust with it. Hindi nila kailangan mag-treat.
So, meron hangganan.
Yeah, as long as you are not, yung quality of life mo, yung functions mo hindi naapektuhan, nakakapagtrabaho ka mabuti, it's okay. Pero once it's already affecting your job, your personality mo, yung relationship mo sa husband mo, at saka sa mga kasama mo sa bahay, you really have to have treatment.
Do you need to have to undergo like a psychological consultation with a psychiatrist or psychologist. Kasi it's a family thing eh. Kasi minsan nag-iiba yung attitude ng mother, no? Naapektuhan yung mga kids. Bakit si mama ganoon nag-iiba ng attitude? Ngayon si mama at si papa nag-aaway palagi. Hindi nila alam that the patient is undergoing a perimenopausal or menopausal stage. Do you advise for that?
Ako never pa naman ako nag-refer sa psychologist or sa psychiatrist. Kasi once you really talk to the patient well, explain everything well to the patient, at na-accept ngayon, and then you give the corresponding hormonal replacement, nasosolve yung problem nila. Seldom ako, I don't think na nag-refer pa ako. So, and then I just give them kasi bisa may mga pasyente ka nag-menopause na, no? Kukwento mo lang yun, and then how they were able to adapt it. Kamukha ako menopause na ako at this stage, no? So yung experience ko, I share it with them. Tapos sometimes nga, meron akong pasyente na talagang lunong-luno na talaga siya, to the extent talagang nakahiga na lang siya.
Talaga?
So, yeah. Tawa ako ng tawa sa kanya. Sabi, doktora, pinagtatawanan mo pa ako. Because I've been there, sabi ko. Okay lang yan. You will pass by that stage, sabi ko. You just let the patient, mag-pass lang niya yung stage na yon, eventually magiging okay siya.
Yung bang hot flashes po, lahat ng babae will experience that during that stage?
Hindi naman.
Hindi lahat?
Hindi. Mga 75% lang ang nakaka-experience.
So hindi lahat?
So sino yung hindi nakaka-experience? Sino yung masuswerte yun?
Usually kasi kapag nag-menopause ka na at medyo obese ka, mataba ka, you experience less.
Kasi ang fats kasi may mga estrogen hormones yan.
Yeah, the fats kasi, yung mga matataba, meron kasi yung mga fats, di ba? And then these fats are being utilized to produce estrogen. That's the estrone. Yung estrogen ng menopause is the estrone. Mapataas ang nila, especially if you under the sun, yung naarawan ka.
So mas mataba, mas lesser yung chances.
Lesser ang symptoms mo.
Bawal magpapayat.
Yun ang advantage. Yung isang advantage lang na medyo overweight ka or obese ka.
Marami kang hormones.
Pero kaya naman, pag overweight ka naman, and then yun naman yung the risk of osteoporosis mo naman.
The back pain.
The back pain because you're overweight. And syempre, part of also ng menopausal is osteoporosis. Once you have lost 25% of your bone mass, you will develop osteoporosis. No? So, number one, inapektuhan yan, yung mga natin, yung mga
joints,
lahat. Yung back natin, the vertebrae.
Kakaroon ka ng back pain.
Nakikita mo, nagkukuba na sila.
It's one
so,
process.
kapag overweight ka, madali kang magkuba. And then, yung mga
positioning
joint pains
mo, lahat.
Yun naman ang disadvantage.
Well, thank you, Doktora. But mayroon akong isang hanging question. Could a menopause patient could still have a good sex? And what's up, Doc? We'll return after these few reminders. Yes, and we're back here in What's Up, Doc. Of course, together with me is my co-host, no other than Attorney Bajamunde. And good afternoon. And alam mo, na-miss kita kasi ilang linggong wala ako. And then it was Dr. Jonah May Cenica. Thank you to Dr. Jonah May Cenica.
Your daughter, your good daughter.
My very beautiful daughter from Hospital ng Makati. And we have a hanging question, ha?
Yeah, magandang question ni Jan.
No, if let's say you are menopause and can you still have a good sex after menopause, during or after menopause?
Well,
siyempre, importante yun, di ba?
Dapat hindi nawawala yun.
Of course, you know.
Oo naman. Oo naman. Kasi naman, yung pleasure naman ng sex, dapat naman din depende sa estrogen level mo although it affects libido, no? So,
libido, okay. Bakit parang nawawalan ka, you lost your appetite?
Oo, kasi yung estrogen kasi may epekto din sa libido ng babae. Siyempre, kapag bababa ang estrogen, nawawala din yung libido, bumababa. So, ang treatment lang naman doon, i-replace mo pa rin ang estrogen.
Okay.
And then, yung satisfaction na sinasabi mo, depende na lang sa dalawa yun.
How do you do it?
Partner mo.
Nagkakaroon ng vaginal atrophy, lining ng ating puwerta. Ngayon, of course, there's dryness. And during the sexual act, of course, you need lubrication. So how do you do it? No lubrication when you're menopause. And how do you substitute the lubrication for women who are suffering menopause?
So meron nga yung mga preparation na mga lubricant, no?
Lubricants.
Yung KY jelly tawag,
KY,
no?
yeah.
But this, wala tayong mga estrogen ito.
Okay.
Lubricant
Plain
ito.
to.
Plain
Plain
lang
lang
ito.
na
Tapos
lubricants.
marami yan sa market, marami na mga lumalabas ngayon.
Oo.
Usually yan, aside, siyempre, kung talagang yung masyado na apektado yung libido ng babae, at saka talagang pinoproblema niya yon, siyempre, bibigyan mo na estrogen yon, di ba?
Okay.
Pero ang effect nun, hindi naman ganun kadali, at saka hindi ganun as is yung walang 100% na parang hindi ka menopause, di ba? May epekto pa rin
Oo.
na
Hindi
yung
na ganun
menopause.
ka, no?
Hindi na, oo. So, ang ina-advise namin yun, before the start of, ano pa lang sila, nagpo-foreplay, binilagyan na niya ng gel yung, yung ano ng asawa niya. Para sa ganon, pag-prepare na rin siya. At saka kasi minsan yung kasi pag medyo may edad na sila, yung foreplay nawawala.
Oh.
So yun kasi
So is it advisable na
Mas mahaba yung foreplay.
manunod
depende
kayo ng
sa
mga
kanila.
video, mature adult video?
Kung nai-stimulation na doon,
Oo,
it
importante
will
yun.
help them.
And
Pwede
ang mas
naman.
maganda siguro, ang importanteng role is the husband, di ba?
Yeah.
To discuss it with your husband.
The intimacy actually.
Intimacy is very important.
And you have to be open.
Love,
also.
Yes,
and
the
love
intimacy.
pa rin nandoon. So may questions, may
Yeah, may mga
text questions sa'yo.
Text questions
Attorney.
for you, Doktora. How to combat the weight gain during perimenopausal or menopausal stage?
Actually, yung weight gain, yung weight gain natin babae, once we reach 35 years old, yung metabolism natin bumababa. Kasi, nag-start na rin bumababa ang estrogen level natin. So, kahit na konti na ang kain mo, ang bilis mo tumaba. Tsaka, yun ang laging complaint. Doktor, hindi na ako halos kumakain eh. Because the metabolism is, slower na rin.
Okay.
Kasi because estrogen has an effect on the metabolism. So that's why during at the age of 35, we advise start mo na mag-exercise ka.
Oh, pero yung mga ibang babae kasi they experience hot flashes, they don't like to exercise kasi masyadong pinapawisan.
Hindi, actually, it's
Advisable.
advisable. Oo, kasi ano yun eh,
Maka-counter.
yeah, maka-counter. Tsaka it will help. Kasi yung mag-ideal body weight ka,
Yeah.
and then bibili sa metabolism
So,
mo,
still-
medyo mawawala.
Kailangan maganda pa rin ang diet mo.
Yes,
Proper
yes.
diet and exercise is very important for you not to gain weight.
Yung po bang tiredness, common yan sa menopausal women?
Fatigability.
Yeah, isipatigibility. Talagang ano yun. Kasama yun. Because nga, nag-i-slow na yung metabolism niya. Tapos
Dali na mapagod.
madali na siyang mapagod. Kasi kailangan din talaga natin yung kumbaga sa lalaki, testosterone. Tayo babae, we really need the estrogen.
So, ibig niyo sabihin yung men of our age, halimbawa nasa menopausal stage ng babae, around 50, yung 50 na lalaki, do not experience that kind, yung mga
Iba kasi
napapagod
sila
agad.
eh.
Oo.
Kasi may andropause kasi, di ba? May andropause. But ang andropause ng lalaki, they come on a later
Very
age.
late.
Later age. How late is late?
More than 60 na.
Okay. So hindi pa
Saka
kasama
depende
doon.
rin sa psychological din ng
background.
ng
And the
lalaki.
lifestyle, probably.
Lifestyle, how they were
Kasi lalo na
brought
kung
up.
ang babae, number one, yung cigarette smoking,
Yeah.
tapos yung matataba kinakain mo, tapos
Poor
alcoholic.
diet.
It also affect your menopausal symptoms.
Napapaaga.
Oo, napapaaga.
Yung may isa pang tanong po, is new fem supplement good?
Ano yun yung new fem is yung parang gamot is the new fem na sinasabi niya?
I don't know.
Siguro
New
parang
Fem-
nutritional
Yeah,
supplement.
new fem is food supplement yon.
Food supplement.
Food
It might help, no? It
Kasi
might
these
help.
are ito yung mga
It might and might not
yung mga
help.
food supplement na nakikita natin sa market. Ang tawag namin doon phytoestrogen, no? These are estrogen, weak estrogen coming from the plants. Na when you eat,
Okay.
pag kinain ng babae, nagpo-produce ng weak estrogen, but not as much as talaga yung kailangan natin, yung level talaga na hindi pa tayo nag-menopause. And this, we call that isoflavone. No?
Isoflavone.
Yeah. Yung lalo na yung soya, mga tofu.
So, aside from
Yeah.
medicine,
Talaga?
may mga
That is a high
natural,
in phytoestrogen.
Nutritional supplement.
Soya.
Importante rin yan
Soya.
kasi you
Actually,
you
dito
take
nang
that
gagaling
every day.
lahat yan yung mga
Oo
food
nga.
supplement na
Sa
sinasabi
soya?
lang for menopausal.
Yes.
Yan, yung flaxseed seed,
Yeah,
Yung
flaxseed,
apple
yeah.
is very rich in phytoestrogen.
Apple.
Okay.
Kaya lang, mapapansin mo, this mga phytoestrogen na to, mga matataas naman sa uric acid.
Yes, yan tatanong ko eh.
So either,
Yun naman yung problema mo. Magkakaroon ka din ng
Sakit
din ng mga joints mo, which is kala mo part of menopause, but yung pala, mataas pala uric acid mo.
Kakakain mo ng anti-menopause.
but if you overeat, talaga magkakaroon ka
So
ng,
you have to check
uric acid.
every now and then yung uric acid mo.
Uric
So
acid.
aside from soya, the apple, what else yung mga natural treatment for menopausal
Ginkgo
symptoms?
biloba is mataas.
Ginkgo biloba.
Tapos
For the
yung,
memory yata yun, di ba?
yeah, although it's for memory, pero mataas din sa
Yung
isoflav yun.
tinatawag na yung
Primrose.
Primrose.
So that is also isoflav din yun. Yung tong barley, diba?
Barley.
Ay, yung barley, oo.
Yes, barley. At saka green tea.
Green tea.
High in isoflav
So,
din.
isisahin natin yung mga nutritional supplements na pwede natin i-substitute other than taking hormonal pills.
Yes.
Oo, yung green tea, sabi nga ni
Yes.
doktora,
Apple?
maganda yan. Apple seeds ba o apple
Hindi, yung
fruit?
apple, the apple.
And then,
Tofu.
Tofu?
Yung miso soup is high,
Miso soup.
Because it's from soya. Ay, soy sauce,
so
yun.
ilista nyo yan, mga...
Soy sauce.
Mga
So,
Pero in moderation din,
televiewers.
baka naman rayumahan
Oo.
yan, ano?
Yun na nga. Yun ang problema natin.
May tanong din po, Doc. Yung mga babaeng na hysterectomy na po,
Yan.
can they still feel the symptoms of menopause once
Menopausal.
they reach that age na?
Yung
Halimbawa,
mga
early pa
na-surgery
lang.
na, mga
na-surgery
natanggal na yung uterus, natanggal na yung ovary,
Ovary.
fallopian tube, can still experience nga
Oo,
yung
menopausal
menopausal
symptoms.
symptoms.
Yeah. Ang tinatawag namin dyan, surgical menopause.
Surgical
So once you
menopause.
remove the ovary, kasi kung hysterectomy, simple hysterectomy, wala namang epekto. That's why, when we do an operation, kung wala namang problema yung ovary, below 50 years old, we do not remove the ovary.
So you retain the ovary.
Yeah, we retain
Oo.
up to 50 years old.
Because women needs the
Unless
ovary.
gusto ng pasyente talaga. Kasi minsan kung yung meron silang history, very mataas ang incidence ng mga cancer sa
Cancer,
pamilya nila.
ovarian cysts.
Yeah, yung mga ovarian cancer.
Oo.
Ayun, kung talaga after explaining everything to the patient at gusto pa rin yung patanggal ng ovary, ginagawa namin yon.
Ayun.
Pero as much as possible, hindi namin ina-advise na tanggalin. Kasi nga, kahit sabi mo wala kang matres and you still have the ovary, nagpo-produce ka pa rin ng estrogen.
Estrogen.
Pero magkaka-hot flashes ka rin ba?
No, kung meron ka pang ovary, kahit isa
Pwede.
lang, hindi mo ma-experience yun hanggat hindi ka darating dun sa age ng menopausal mo.
O nga po, kahit wala na kayong ovary, may experience pa rin yung mga hot flashes
Yes,
kahit
kasi surgical menopause ka na eh. Lalo pag dalawang ovary yung tinanggal mo, maaga mo ma-experience ang menopause. So what we do, we give replacement therapy, yung HRT.
So pag na-hysterectomy ka na mga 35 years old, you need na
Yes. Usually within a year yan eh, okay ka pa eh. And then after 1 or 2 years, ma-experience mo na yung menopausal symptoms. That's the time we give the hormonal replacement therapy.
Is there an effect sa skin ng babae?
Yeah,
Yes,
oo,
yeah.
very,
Para siya,
very.
maganda yan. Ang gandang question yan.
Kasi estrogen is, di ba, ang tonicity ng ating skin is the collagen.
Collagen,
Di ba?
yes.
Yung dami ng collagen sa katawan.
Correct.
Kaya pag nami-menopause ka, nagre-wrinkles na tayo because bumababa ng estrogen, ang collagen natin ng skin. And estrogen is very important in the synthesis of collagen.
Ayun.
So you have to
Kailangan mo ang estrogen to synthesize collagen.
Kasi sa Japan, ang daming collagen tablet,
Oo, mga
collagen
collagen
powder.
capsule.
Ang hindi ko lang
collagen
alam
creams,
kung sa absorption mo, kasi kung wala kang estrogen, how can you synthesize
Right.
the
minsan
So ano po yung magandang gawin ng isang babaeng nagpe-perimenopausal or menopausal to take care of their skin para medyo hindi naman kumulubot agad?
Yes.
Yun na nga, I advise them to take the mga isoflavs, yung phytoestrogen.
Ano yan ulit?
Yung mga phytoestrogen, yung phytoestrogen, yun ang component yung isoflav, yun yung sa phytoestrogen. Yun yung
Is
parang
that
estrogen-like.
it contains estrogen or
It's an estrogen-like. Yung
estrogen-like?
structure niya is
parang
like an
precursor
estrogen.
lang.
They are plant estrogen.
Ano po yun?
When you take them, may effect
May
din
effect
sa
din.
atin yun.
Estrogen?
These are plant
Parang
estrogen.
nutritional
Oo,
support
nutritional.
for
Pero
estrogen
the
production.
structure is the same as the estrogen.
Ano po to? Vitamins that you can buy over the counter?
Meron. Oo, yung
OTC
mga
na sila.
primrose, at saka yung from the tofu, yun. Yun ang phytoestrogen.
So, importante rin din yung talaga nutrition, no?
Yes,
sa isang
oo.
pasyente. regardless if you are menopausal or perimenopausal or postmenopausal, nutrition
Importante talaga.
yun.
And the exercise.
Exercise.
May complication po ba ang menopausal sa isang
The
babae
worst
po?
complication that you encounter.
Pag menopause ka na, yung mga diseases that is na very very prone ang babae is heart disease.
Heart disease.
Because estrogen is cardioprotective. Ibig sabihin, pag mataas ang estrogen natin, pinoprotektahan na ang heart natin, ang mga arteries natin from atherosclerosis. From aging also. So pag wala ka na rin estrogen, nag-age na rin yung mga arteries mo, mga veins mo. Kaya madali kang prone ka sa heart disease. And then sa diabetes.
Diabetes. Yes.
Diabetes
About bony
din.
effect sa
Yun,
both
mga
natin.
osteoporosis.
Osteoporosis.
Kasi ang estrogen, you need estrogen to absorb the calcium that you take.
Okay. So
Kailangan sa
estrogen is
tiyan.
important to
Yeah,
absorb all
to
these
absorb.
vitamins.
Oo.
po.
Yung
Like the
kailangan mo.
collagen.
Yeah, kailangan. Kaya yung collagen na cream, I don't know kung ano ang magiging effect kasi hindi systemic ang intake, di ba?
Pero in Japan nga, there are plenty of collagen type of medicine. Merong powder type. You have to mix it sa drinks mo
Yeah,
yata.
at saka yung capsule.
No, it's, kahit
Capsule.
nasa grocery na sa
Importante
mall,
yan eh.
At saka yung mga cream, di ba?
Yung mga
Hindi ko lang,
orals.
although ako I take, no? Kaya di ba, kamukha ng collagen, yung
Yes.
iniinom ko, you have to take 2 tablets 3 times a day. So it should be in a
Dami.
high concentration. Di ba?
Talaga?
Ganon?
2 tablet.
Any other, like say,
laki-laki.
vitamin supplements other than
The collagen.
the estrogen-like, any, let's say,
Vitamin
B,
E.
A, or D?
Yung
that
kasing
you could,
vitamin E naman, di ba, helps na rin sa
Right.
kailangan natin for the skin din, di ba? Makakatulong yun.
Makakatulong
yun.
Oo.
Vitamin A, makakatulong. Pero hindi talaga yung pag nag-take ka, talagang magic ang effect sa'yo. Hindi rin.
Yung
Depende rin sa katawan mo.
Yung primrose na sinasabi niyo, may collagen po yun?
No, it's kasi ang primrose is parang, yun nga, it's a phytoestrogen, it's converted to isoflav. Yun ang parang synthetic o sabi na, plant estrogen na tinitake natin. Pero the effect is, hindi ganun ka ganda as in estrogen, HRT talaga.
Let's go back again to yung pinaka-basic, yung hot flashes. Now, once you feel these hot flashes, before we end the show, ano ang talagang magandang, other than hormones, na pwedeng ibigay sa pasyente during the process na, parang ang feeling ko, mainit. Ano pinakamagandang treatment na bibigay natin during this period?
May mga discomfort na gano'n.
Discomfort.
Immediate relief.
Yeah, immediate relief. Usually yan, I advise the patient na, ako ina-advise ko, uminom ka maraming tubig.
Oh.
And then, I advise, you go out of the room.
You go out of
You go to yung mas presko. Pero in terms of another medication aside from HRT at saka yung mga fighters, wala na talaga except the food supplement.
No.
At saka it's a matter of attitude.
Yun.
Kasi if you accept
You have to
early,
accept the reality.
Yun ang sinasabi ko palagi sa it's a process. It's a process in the body na if you na-accept mo kaagad,
Ready
madali,
ka. Your body will be ready.
Psychologically, makaka-adapt ka eh.
Pag may denial, mas mainit
Mas
siguro yung hot
mahirap.
flashes.
Oo,
no?
sabi, hindi ako nagme-menopause,
nagre-refuse.
ano lang to.
Yeah.
Mainit lang ang ulo ko.
And that's how
Tapos
powerful.
pinapatulan pa ng husband, pinapatulan
Yun pa,
ng mga
isa.
bata.
Oo.
So add up yun.
Very powerful kasi ang brain natin.
Yes.
The brain can tell the body
Yeah.
na stay
Totoo
calm,
yun.
stay
Yeah.
cool, di ba?
So, yun ang pinaka-importante. Hot flashes, kinakailangan stay cool. Manood ka na lang ng television.
Positive attitude.
Positive attitude. And
probably let
probably
the people
good
around
nutrition.
you.
Good nutrition. As prevention. Good nutrition. Yung mga nabanggit natin mga pagkain
Yeah.
kanina.
Exercise.
Diet, and
Family support.
Yeah,
family
let the people
support.
understand what
Yeah.
you're going through.
Exactly.
Oo.
Wow,
Kausapin mo
I've
them.
learned a lot from you,
Oo nga.
Doktora
Then I have a
Generalao.
last question for
Sige.
Doktora. What is your advice for women undergoing or having this kind of symptoms? Perimenopausal and the menopausal po. Ano po yung mga advice niyo po?
Well, number one, you have to consult your OB-GYN.
OB-GYN,
Kasi hindi nang naman lahat na yan dahil lang sa menopause. So you have also to have
Exactly.
to rule
Mamaya
out
ibang-
other
yeah.
diseases,
Other diseases,
that may cause also
Baka
that
may mga
problem.
uterine
Baka iba,
problem ka.
Oo, at saka minsan sa thyroid,
Thyroid.
hypothyroidism, hyperthyroidism.
Oo.
It will also cause the same symptoms.
Yes,
eh.
opo.
Yun. So dapat
So that has to be ruled out
Yeah,
muna.
after ruling out everything, so talaga kung talagang diagnosis menopause, HRT talaga.
That's right.
Marami na ngayon na
Kaya nga sabi sa mga gamot, if
market.
any symptoms occur, consult your physician.
Yes.
Punta ka kagad sa doktor.
Oo.
Tsaka yung an-apple a day, ano?
An apple a
an
day, yung
apple a
pala,
day, totoo.
Keeps the doctor
hormones
away.
a day pala yun.
Yeah, oo, ngayon ko lang nalaman
Ako, kasi ako naman, I did not experience that menopause. Very early ako, mga 38. Pero kasi nung I started yung apple na sinasabi mo, 40, so hindi ko masyado naramdaman yung hot flashes na yan.
When you say apple ba, yun ba yung computer o yung
Oo.
iPhone ba or iPad?
Yeah,
Then, just kidding. Okay. Thank you very much, Doktora.
Thank you,
And
Doc.
alam mo, before anything else, noong napunta ako ng Miami, there's what you call allogenic stem cell. They inject stem cells onto the vaginal wall and to the clitoris.
Yeah.
Well, thank you very much. Where can we find you, Doktora? Where's your clinic? I mean, saan ka na, anong hospital ka? Na makikita si Doktora Natividad Generalao ko.
My clinic is sa Manila Medical Center, Manila.
Medical
sa may
Center
TAF,
Manila in Taft
harapan ng
Avenue.
NBI. Monday, Tuesday, and Friday.
What time?
I usually there 10 to 1.
Eh, yung clinic mo sa
Sa
ano?
bahay,
Sa bahay.
Pandacan.
Sa
Savior
Pandacan.
Clinic.
Yeah.
But I do that, my clinic is 5 to 7.
Yes.
But I only work Monday, Tuesday, Thursday, and Friday. 4
Wow.
times a
Thank you
week.
very much. Tony,
Thank
you
you,
have
Jen.
any
Very educational.
plugging or whatsoever?
Wala naman siya.
Wala naman. Okay. And you can find us at www.jancencosmeticsurgery.com. We have a Facebook and Instagram account. And we have a clinic in Manila. Telephone number there is 521-1444. And look for Rhea Udale. Mamimiss ko si Rhea.
Oo nga, mawawala
And
na
of course, in Pampanga, in Angeles, Pampanga, with Dr. Buddy Kililan. Okay. And thank you very much, Dr.
Thank you,
Generalao. Thank you very much, Attorney. And hope we can invite you again for another topic regarding OB-GYN. And this is Dr. John Cenica for another episode of What's Up, Doc?